Hello, everyone, and welcome to another Gypsy Nurse Live. I am your host, Rachel Altum, the online community manager for the Gypsy Nurse, and I have a burning question for you all. Are you ready to experience a different opportunity in the new year? It's coming up. I know it's still the beginning of December, but I know it's coming up. But I do have good news for you. Whether you want to travel across the country or find a local opportunity close to home, AMN Healthcare is here to support and guide you to that journey. So I'd like you all to join AMN Healthcare team as I say goodbye to 2022, discuss predicted trends for 2023, and the benefits and resources available for nurses on every assignment. Now, before we get started, I'd like to share a little giveaway that we're doing. I know AMN always is famous for their fun giveaways, but we have one going on the gypsynurse.com. So if you register to become a member on the gypsynurse.com, you'll be entered in our weekly giveaway of $500. Yes, that's right. We're giving away $500 once a week until the end of the year. So be sure to register today. Our next drawing will be on Friday. So hurry up and register so you can get those entries in. So without further ado, I'd like to welcome the lovely faces of AMN. We have Saundra, Alana, Mark, and Jason. Hi, guys.
Hi, thanks for having us again, Rachel. We're so excited to be here. And what an awesome contest you've got going on.
Oh, yeah.
Nice $500.
Yeah.
Especially at the beginning of December. That's the time to have it.
Definitely. Yeah. So it's been a while. So I'm glad that you guys have been able to come on before the end of the year. So I'll go ahead and let you take it away.
All right. Thanks, Rachel. Well, we're so excited to be here again with you. We've done a few Gypsy Nurse Lives, and we always love coming back and being able to just speak to the community, have you ask all of those questions that you have. I see we've already got some people throwing in some comments, so keep those comments and questions coming. We have a lot to talk about, but we, of course, want to hear from you. I will start off by just introducing my lovely team here. So my name is Saundra. I'm a divisional vice president for our nurse division in training specifically. And I am joined by some wonderful team members. So Mark, I'll go over to you first.
Perfect. Well, hello, everyone. My name is Mark Jones. I am currently a clinical manager with the AMN International Division, specializing in bringing in nurses abroad here to the U.S., and a former AMN travel nurse for quite a few years prior to this role. So thank you all for having me.
I love it. Thank you, Mark. And we're so happy to have you and have you as a former AMN traveler. We'll be talking a lot about that as we go through. Alana, why don't we go down to you?
Hi, everyone. I'm Alana Price. I'm a recruiter here with AMN. I'm on the short-term travel nursing side. So I take care of all of the travel nursing contracts, tech contracts, all that fun stuff. So thanks for having me, Gypsy Nurse.
I love it. Welcome, Alana. We'll hear a lot, of course, about travel nursing. So excited to have you. And then last but certainly not least, Mr. Jason, go for it.
Thank you, Saundra. Hi, everybody. My name is Jason Boise. I'm a director of staffing with AMN on our local side. So we're basically here to help fulfill, I would say, day-to-day or gig assignments. I work with our recruiters, and I'm glad to be here. Thank you.
Awesome. Thanks, Jason. I think this is the first time we've brought on a local leader, which is really cool. So you can hear a lot about not just what we do with travel nursing, but how to get maybe a little bit of that flexibility that we know you're all looking for. So Jason's going to talk to us a little bit about that later on. If you've been with us before, you know that I can't start any of these events without first thanking you, all of our amazing clinicians. Whether you travel with us or not, we're just very thankful for you and for all of the hard work that you put in, everything that you do day to day to take assignments at home, abroad, and to support the communities that you either live in or feel inspired to travel to. So just a huge thank you from all of us. We, of course, could not do what we do without you, but even more importantly, our families, our friends, the people that we love and care about could not get the care that they need without all of you. So just a huge shout of appreciation before we jump in. Rachel mentioned it. We love to do our giveaways while we're with you. So my first one is going to be to get the conversation going with all of you. So I have a $50 Amazon gift card for the first 5 people to throw a question in the comment section for me. So throw your question in. If you're among the first 5, you'll just get an Amazon gift card. So maybe you can do some shopping for yourself and not have to worry about spending that on anybody else. You'll see we're feeling festive here with both Alana and Jason having their holiday backgrounds. I love the lights, guys. Thanks for bringing the festivities to us. But with that, we'll kind of get started. So they're bringing the holiday experience for sure. We know you're hopefully all feeling that too. But one of the things that we wanted to start off with was just how are you looking at that experience for 2023? And how are we as your team really helping you? So I think, Mark, I was going to go to you first to just talk a little bit about being a former travel nurse and what you and your wife experienced and just kind of what drove you to that.
Of course. So I think our journey started out probably like pretty much any other bedside nurse here in the U.S., graduated school, figuring out, where you want to go out, be independent. We ended up settling, core staff jobs in the state of North Carolina. We're there for about a year, and then we said, you know what, we want to go adventure. We're still at our current age, no children, no, real major life responsibilities, still renting our home. So might as well, now's the time to get out there and kind of seeing everything. So we sat down and kind of mentally prepared and said, where are our top destinations? Obviously travel nursing is great for many benefits, but for us, it was, where do we want to see in the US that we otherwise would not have that opportunity to see? So we said, all right, let's go as far as we can for the first one. And we hit Seattle, Washington for that first assignment. And then ever since then kind of bounced around city to state. I think we probably did about 11 or 12 different assignments across almost 5 years. And then ultimately kind of led to our core staff or core positions, I should say, here within AMN on the corporate side, helping those other nurses in their journeys as travel contracts and long-term staffing solutions for our international nurses.
I love that, Mark. And I love that you talk about your kind of final destination position here at AMN, but also how awesome. I didn't realize that you completely traveled across the country. So you're one of those brave ones that said, you know what, I don't need to be close to home. Let's just jump in and go for it. We are getting a ton of questions, which I love. So just a reminder, the first 5 questions in the chat will get that $50 Amazon gift card. First question I have is from Angel111. What are the hottest positions, or where will the hottest positions be in the new year? Let's start, Jason. Where do you think the hottest positions are for the new year?
We have some really hot needs for RN, med-surg, ER. We're seeing an increase with that. ICU. So for us, it's across the board, but the float pool is really important for us. We're hearing a lot of our clients say, hey, we need float pool, we need float pool. So really looking for more RNs in those specialties. Yes.
I love it. Thanks, Jason. And you talked a little bit about that float pool and our clients, which are facilities, all the places that you go to work, really looking for something different in the new year. And really as we continue with this market. So we'll talk a little bit more about that. It's a good plug too, Jason. Alana, where are the hottest needs?
Yeah, definitely. I can agree with you there. I am definitely seeing pediatrics right now. As far as location goes, California is always pretty hot in needs for sure. That's definitely an area where we see a lot of contracts available. But as of right now, as far as specialties go, we're seeing pediatrics, pediatric ER, those kind of places right now due to the RSV surges, unfortunately. So those are just kind of some ideas there.
Yeah. And Mark, I know in a bit you'll talk to us too about all of the nurses out there kind of getting used to this ebb and flow a little bit more. And kind of thankfully, we're going back to that more true seasonality, right?
Yep, seems to be kind of heading in that direction finally, after being nonstop to the wall every single moment of every single day for the past couple of years. It's nice to kind of have those ebbs and flows again. Unfortunately, that's coming out right into flu season and RSV season and COVID season where we're at a peak again. So hopefully, as we get into this new year, things will eventually calm down as we get into the spring, become a little bit more normalized, which is great for everyone and their peace of mind as well.
I think we're all looking forward to that. Angela, great question. How much experience do we need to work with AMN? So I will start this, and then Alana and Jason, feel free to jump in, because Jason might be a little bit different for you than what I understand. But we can start working with you, meaning you can put an application in with us between 6 to 8 months of experience. We won't actually be able to travel you until you hit that 1 year mark. We do have a lot of recruiters who are specialized in early and career nurses. We want all of you to just be out there and everywhere that you want to be. And we know that building and continuing to grow your career is incredibly important in travel nursing, or taking a local assignment is a great way to do that. Jason, would you say anything differently?
It is a bit different. So for us, we need to have at least 9 months in the last 3 years of the specialty that you're working in currently. Or 9 months within that 3 year period. So if it's multiple specialties, as long as you have that 9 months in those 3 years, come on board. We'd love to have you.
I love it. Yeah, and then we can help you build up all of that great experience and have new opportunities, which is what the new year is all about, right? All right, so Robin Young, I love this question. It's actually one of the topics we wanted to go over, but what are you doing to support clinicians related to burnout? Mark, I think I'll come to you first because you have a pretty unique perspective, being a clinical manager and having your wife be in that same position on the travel side. So what are some of the things that you talk to our clinicians about?
It's a great question, Robin. I think we handle these conversations on burnout almost every single day as we support our nurses that are on assignment across the U.S. And now my role personally, I'm working with our international nurses who are on a much longer contract as opposed to the typical 13-week. Our nurses are typically closer to 2 years on contract. So we do a lot of support, coaching, counseling with these nurses on our clinical team. We probably have the industry best clinical team in terms of support that you can get, both long-term, local, short-term staffing, allied physicians as well. So one of the things that we do is we have that conversation with you. We touch with you. What do you need? Can we just listen to you? And if we need to go more than that, that's where the great thing about AMN is we have what's called the Employee Assistance Program resources, where we can get you those different programs that you may utilize. Maybe it's a counseling session, maybe it's financial planning, whatever the stressor in your life is that is increasing your burnout that you're feeling at work, because we know those social aspects drip into work. Eventually, the more stress you have outside can add into it, on top of those long work days, on top of that short staffing, the tough patients, and the COVID crisis. So we have a variety of different resources that we can send over to our teammates, and personally have experienced using these resources. They're great. You just have to ask. I always tell our nurses every time I talk to them, I would love if my superpower was being able to read minds. I just haven't figured out how to do it yet. So the best way that we can help you is that open communication with us.
Yeah, that open dialogue for sure, Mark. And the EAP is one piece of that. It's definitely something, Robin, and for all of you on the call, that is top of mind for us. We know that recently it has been something that has been top of mind for all of our clinicians. It's how you're feeling. I cannot imagine how you're feeling after the past couple of years and just the environment that you're working in now and stepping into, and that continued call to really help and support. Mark kind of hit at it a little bit. We know that sometimes for our clinicians, it's hard to ask for help. You're used to being the one that's taking care of everybody else. And it's really hard to step back and say, you know what, I need the help and I need someone to step in for me. We want to fill that void for you and be that person that can really help support you. Jason, anything that you would add in addition to our EAP?
Oh, yes. So there's a lot of resources with EAP. We have a counseling, wedding planning, housing. I'm currently going through that myself with moving and having a new home. So there's a lot of stresses there. So really great resource. You can call in and speak to certified public accountant. If you have a financial question, life events, like I said, mortgages, work-life solutions for child and elder care, if you have those that come up and you have need for that. Legal support and guidance for housing matters, such as landlord and tenant issues that you might come across as well. And so all of it's free, and that's just a few to name.
Yeah, lots and lots of support in all those different areas. So Mark hit on a little bit. It could be, and we know that it's that day-to-day kind of work stressor. But all of those little things that Jason was talking about can definitely add to it. I will say, in addition to our EAP, we also have a hardship fund where Mark, you're nodding your head. Do you want to take over for the hardship fund piece?
We actually talked about it recently. So that hardship fund, great way for our AMN employees to, life happens, crazy events happen, whether it's a death, whether it's a tragic accident, some sort of hardship that you may come on. And I think we had a meeting the other day where I think we've had $509,000 donated so far to the hardship fund. So certainly something that we are passionate about as an organization and something we really want to look forward to using for those who need it within our organization.
Yeah, absolutely. And thank you for that, Mark. So something that when Mark says AMN employees, as a traveler with us, you're an employee just as much as Mark, myself, Alana, or Jason are. We believe that you are part of the team. So we want you to feel supported in those ways. So lots of things, Robin, we could probably go on and on about the burnout piece, how we want to support you. I think this goes hand in hand with some of the changes that we're seeing our clients or our facilities make too, with changing up the way that they're really looking at nursing teams or float pools, as Jason mentioned. To help make sure that you have that support when you're on a unit, to really tap someone and say, you know what, I need help with this patient right now, and to have that additional support. Because Mark, feel free to correct me if I'm wrong, but it sounds like a lot of that is coming from just being the only person that is really there taking care of patients. So we want to help our facilities as well get to that new normal, whatever that looks like. All right, we'll go back. Lots of good questions. So thank you guys. I love this. I love the dialogue. How recent does full-time experience need to be? So how recent does full-time experience need to be? Alana, for STTN, what does that full-time need to look like?
Yeah, so as far as full-time goes, within the last year is definitely most important within that unit. Kind of Sandra touched point on it earlier. That would be definitely the most important in being on that unit.
Yeah.
Full-time and clinical can support you. And it's never too early to get a profile set up with AMN either. That's one of the things I wanted to mention when we were talking about that is, again, it's never too early to get a profile started and get everything you needed to start travel nursing. That way, when you are ready, you can submit to jobs right away.
Thanks, Alana. Yes, you're right. So Mark, I'm sure you can jump in a little bit here too, but if you're looking to travel with us, you need experience within the last 3 years. And that can vary based on what your experience looked like prior to that as well. If you have any specific questions or if you want a recruiter to take a look at your information, Jane, feel free to reach out to your recruiter. If you don't know who your recruiter is, I'll make a little plug here. You can make sure to download the AMN Passport app, and your recruiter will be right there within the app. You can ask all of the questions that you have and get set up so that you're in the best spot to travel. Mark, anything to add? I saw you come off mute.
Yeah, and I think if I'm not mistaken in that Passport app, I think it shows you your other support personnel that you can contact as well. So your clinical liaison or clinical manager, your payroll specialist. We have a huge team here within the organization that everyone is specialized to help you in some sort of way. You don't have to rely on one person to have every single answer.
Yeah. And Mark, anything from your travel nurse background where you would speak to that a little bit and just maybe about the benefits, or if there were, maybe even some opportunities in that, I'm open to it as well.
Yeah, from our experience, we had an amazing recruiter. She really made that experience for us, and she made that the reason why we never jumped from AMN to other travel companies. It's easy to price shop as a travel nurse and kind of look around at what the different packages are, but that better relationship that you have with your recruiter and the more open communication you have, the better your experience is going to be when you are on assignment, when you're out there on the road away from friends and family. Maybe it's just you by yourself, maybe it's you with a pet, you with a significant other, but that still can be a lonely feeling at times. So once again, our recruiter really made that experience for us. But one thing we didn't know throughout our 5 years traveling is we did have clinical support. If I was on a unit where maybe things were a little bit tough, I was kind of questioning some of the practices that were going on, maybe by a charge nurse or somebody. I didn't know that I had that clinical support person. So I think that's a great thing for everyone to know, that they can reach out. That clinical manager, clinical liaison can be an advocate for you and really help you find a solution to whatever may be troubling your mind at the time.
Yeah, and I think for a lot of our travelers who use our clinical managers, and Jason, you were nodding your head there too, but it is, you can find that person, whoever is assigned to you, within that AMN Passport app, which is great. So all of your contacts, as Mark said, are there, but they really are there to help you with an array of things that might come up while you're on assignment. So as Mark was kind of talking about, maybe there's a charge nurse you're just having a little bit of difficulty communicating with. They can help you with having that coaching conversation and helping you through that dialogue, which is sometimes really tricky. Jason, anything to add?
We're passionate about building relationships in local. You wouldn't say it's unique to us, but it's unique in the sense that we have a lot of opportunities to speak with our clinicians, and so building relationships is our highest priority. And because it is gig staffing and it's on a float pool type situation, we have those opportunities. So it all starts with the interview. We want to seek to understand what motivates you, what's important to you, because we do schedule with our client float pools, or just a call to say hello. So it all starts with that first phone call. And I can actually think back to the relationships that I've built over the years with clinicians. It was that first phone conversation among many that built those relationships.
Absolutely. Getting to know who they are as a person, what all of your motivations are. You all travel for such different reasons, and we want to know that. Alana, anything to add?
Yeah, just kind of piggybacking off what Jason said, same thing in short-term travel nursing. So important to build relationships and find out exactly why you're traveling. What are your motivations? Is it for experience and adventure? Is it for financial reasons? We love to ask a lot of those questions so we can nail down the perfect assignment for you and make sure that assignment's worthwhile. So definitely building relationships is so important within local and short-term travel nursing and AMN altogether. Your clinical managers love to make relationships with you. Your credentialing analysts will make relationships with you. It's amazing the amount of relationships that can be offered here at AMN.
Yeah, thanks for that, Alana. So if you're not hearing it, you hear it now loud and clear. We, of course, will text you if you are on the unit and you're not able to chat with us, but we really do love to talk to you and get to know you as people. It's so important. We know that in some cases, like Mark, you may be traveling all the way across the country and not know anybody and not know what you're headed into. So we really want to help you with all of that and really get to know who you are as a person. All right, we have so many questions in the chat, guys, so I'm going to speed us through a couple. What are some of the new things being offered in the new year for per diem and contracts? And that's from Shauna. Jason, we kind of talked about it a little bit, but this like float pool nursing team thing, do you want to talk about that a little bit more?
Yeah, so I would say just in line with the float pool, we're hearing a lot of our clients say that they need that flexibility. They're under a lot of stress and burden, as you all know. And then even with the clinicians as well, we're seeing, that need to build a unique schedule. We have clients that are like, listen, if you can work 2 days a week and it's the same 2 days a week, we'd love to work with you. So that flexibility is going both ways. And so I think we're seeing more and more of that as we enter into the new year, coming out of this, we're at the endemic now. So I feel like, local is going to be a critical component to that.
Yeah, and really stepping in. Mark, anything to add on the team nursing or kind of that float pool piece, or maybe explaining a little bit of what that looks like for our listeners who don't know?
Yeah, I think when you're going into a travel contract, whether it's short term, whether it's local, whether it's a longer or just per diem shifts picking up, it's great to have that mindset of floating probably will be an expectation for you. There is probably a couple of assignments where I was going to it. They tell you there's such a great need. I was CVICU in particular. So there's a great need in CVICU. Then I get there and I float 75% of the time over to neuro ICU, which was my least favorite of any of them to go to. So, when you aren't expecting it, it makes it a little bit tougher. It kind of adds to that emotional stress a little bit. But then we just had to flip our mindset, say, yeah, you know what, we're travel nurses. We're probably going to float the majority of the time. But once again, if you have questions, concerns, you're floating to an area that's not comfortable, that's where you speak up and advocate for yourself. You follow that chain of command. You talk to your charge nurse, your manager. If it's night shift, pull in a house supervisor, but then pull in your clinical team here at AMN, because we can go and advocate to those nurse managers as well. We can go do some education sessions with them of, find out, as Alana mentioned, what's the motivators for your nurses to be here. Ultimately, you want to try to get someone on core staff. Travel nursing is a temporary fix, but how do we attract quality talent to our team? you know what their motivators are, you know what's bothering them. And that's where, we can kind of collaborate both as a clinician, as a business in the AMN, and then with our client partners at the hospital.
Yeah, and I love so much of that, Mark, and so much of what you're talking about. We hear our clinicians say as well, right? So travel nursing is great, but that kind of end goal is to go someplace that you maybe really love, as much as it pains us to lose you as a travel nurse, but go someplace that you really love and to fill that need for a community that you feel passionate about being a part of. So definitely loop in your clinical manager. You can use Passport. You can call them directly. We also have 24/7 support line. So if your particular clinical manager isn't available, there will be someone that you can talk to. So really important feature there. Chrissy asked, typically, how long are these contracts? So we have a couple different answers. Alana, how long are they typically for travel nursing?
Yeah, so for travel nursing, they're typically 13 weeks. They can go as high as 26 weeks. We sometimes offer 8 weeks, but typically you're mostly going to see them at around that 13-week period.
I love it. Perfect. And then Jason, what about for local?
So yeah, the key word here is flexible. So we do have 13-week contracts as well. So we can offer that. It's more of I would say an ongoing basis in terms of the client's needs. So it could be 2 weeks, could be 4 weeks. So again, flexibility is the key word there. And I'll tell you, we have clinicians that have worked with us for many, many years. They love that flexibility. I think I have a clinician that's worked with us that I'm aware of personally for over 6 years now. So it just really depends on what the client's looking for, what your availability is. And when we can marry those two together, it's a great relationship.
Yes, absolutely. And you've heard us talk a lot about flexibility. You can tell that we hear that from all of you, our clinicians, our nurses. And we love that that's something that we're so focused on, is having that flexibility for you, being able to travel or work in an environment that you feel really comfortable, and that you feel like you can make the biggest impact on. Being able to provide you that flexibility feels to us like a big answer to some of the burnout that you're feeling as well. So in addition to some of these other things to help you through those moments, being able to provide you a work environment where you're going to feel that flexibility, feel that support, feel all those things that you should in your work assignment, wherever that might be, is a big focus for us. Mark, I saw you come off mute too. Anything to add?
No, I think you're covering it all perfectly there. I mean, you pretty much covered all the points that I would have said.
Perfect. All right. So Karen, does AMN use a network for obtaining care for its members? I think, Karen, what you're asking for or asking about is maybe our health insurance benefits. We do offer health insurance to our clinicians. We have several different options. We do also offer day one preventative care coverage. So if that's something that, you don't need the huge flashy PPO, you just need something to cover you in case of emergency, we provide that as well. So lots of great options for you in that piece. Sujod, I hope I said your name right. What is travel nursing looking like for 2023, both local and nationwide? So I think we've talked about it a little bit, but what you're starting to see in this new environment as we're coming out of and really are in that more endemic state at this point from COVID, something that none of us were prepared for. We really are seeing facilities look to find new ways to meet their needs, but also make sure they keep the doors open, quite frankly. So they're looking at some of these different ways to have team nursing, float pools. Maybe we bring in some local travelers or some per diem travelers for this time period. So we're really starting to see a lot more of that. One of the things that we've heard from you all loud and clear as well is that there's a little bit of unstable and kind of uncertain feeling with travel nursing as you see cancellations maybe peak 1 minute, and then the next minute it seems like the need has increased all over the place. And that really is coming from this kind of unstable feeling that some of our clients, really all of our clients are feeling, just trying to figure out what does the future of healthcare look like, and how can we make sure that we're in a place that we can support it. So Jason, I know you were going to talk a little bit about this, just kind of what that environment looks like and where some of that uncertainty feeling might be.
I'm sorry, I missed the first part of that question.
No, that's okay. And actually, you know what, Jason, I'll come back to you because Mark, I just remembered you had a great story about cancellations and you and Lauren being on travel assignments where you were canceled. Because I think the other part of this is that most of you take the housing subsidy and find your own housing, which can also be a big stressor. So kind of two-part there for you, Mark.
Yep. So, I told the story to our team here the other day, but decided it'd probably be a great experience to share, with everyone else. One of our assignments that we took happened to be, out west, and during that time, middle of the winter, I think it was January to March or January to April was our time frame with the 13 weeks to be there. But as we were, out there working, my wife does peds, and out in one of the major children's hospitals, flu and RSV just did not hit like it was supposed to. So they had brought on a ton of nurses. We had signed these contracts, maybe 4 or 5 months in advance, just because we knew it was a wintertime need. We got out there, working, everything's fine. All of a sudden we get the call from our recruiter, hey, Lauren's contract's going to get canceled because of low census. They're canceling every single, pretty much travel nurse that they have on the several floors. And so we're sitting here thinking, oh my gosh, what's next? This is maybe our 3rd or 4th assignment that we've done, never had this issue. I think one of the blessings for us, though, in that is we had taken the company housing in terms of the apartment that we were in. And once again, going back to that great relationship we had with our recruiter, the one thing you want to know is what happens next and how fast can we get a turnaround time. So constant communication, multiple times a day with our recruiter, trying to figure out, what hospitals do we have close to us? What hospitals, are further away? We're on closer to the West Coast in the Mountain Time Zone. All of our friends and family are on the East Coast. So it's not like we have somewhere we can just go stay and hang out for a couple of days. But the benefit of that AMN housing rather than subsidy is took all the stress away from us. We didn't have to worry about anything, didn't have to worry about breaking our lease, paying an early lease penalty fee. So that's kind of one benefit of that. I know on the other side, the housing subsidy, a little bit more flexibility and freedom and taking that money to find your own. Sometimes you can find a little bit of a better bargain. But for us, it was that stress of not having to worry about what to do next. And then all of a sudden, our recruiter comes through clutch and finds us an automatic booked assignment within a matter of maybe 24, 28 hours. So we're extremely happy with how that played out, despite it being a negative situation.
Yeah.
Our recruiter also handling that conversation of me still being on contract and having to break my contract because I'm not just going to let my significant other move across the country by herself. So, they helped us handle and facilitate and advocate to where, it ended up not being a do not return to that particular hospital.
Yeah, to really help have that conversation, which can be scary as well. So you heard a ton of stuff come from what Mark was talking about. One of the things I'll go to Alana for is that AMN company housing. So it's something that not a lot of our clinicians utilize, and we understand it, but it is something that we provide. And Alana, I know you were passionate about several aspects of our company housing.
Yeah, I'm super passionate about our company housing. I think it's extremely stress-free. We take on all the stress. We have a whole dedicated housing department that finds, number one, is safety. So they find the safest area for you, exactly what you need. If you need to bring your pet, we make sure we find accommodations for that. And they will call you several times a day and show you listings and be like, hey, is this okay? Like, are you comfortable here? I've had a few of my clinicians take housing, and it makes such a difference in the experience. And I noticed, like what Mark said too, if you do get canceled, you don't have to take on any of that stress. You don't have to deal with breaking a lease. You just pack up and go. Just like when you get there, you just show up, everything's already taken care of for you. So definitely such a great component, especially if you're a first time travel nurse and you're a little nervous about taking the subsidy, nervous about finding something. I think it's a great way to go.
Something that's there for you. It's another resource that we want to provide. And Mark, I know you told us, you didn't say it this time, but you do have 2 large dogs as well. So the housing was definitely very important for making sure that there's a place for those guys to be. They're part of our family. And we know that so many of you travel with pets and they're your one buddy that's out there maybe with you. So we definitely want to make sure we take care of the entire family, fur or no fur. Jason, when someone gets canceled though, what other options do we provide to them in the interim? Because like Mark was saying, some of you are traveling all the way across the country and you can't just go back.
Yeah, again, I can't help but not get away from that word flexibility. Like, we're such a great solution for that. So unfortunately, when a cancellation does happen, we're a perfect solution for that, to work with our local recruiters to help you get on an assignment as quick as possible. And that's our goal. We really want to work with you to get you back to work as soon as possible, filling any type of shifts or availability that you have. But we're really a great resource to kind of be that interim from when you end a contract to when you begin a contract. And I have a lot of recruiters that are like, yep, I'm working with a traveler recruiter right now. They're going to end their assignment, at the end of December, and they're going to pick up another one in February. And so it's an ideal solution for those situations.
Yeah, absolutely. It just gives you, again, that peace of mind, that flexibility, that thing that they can kind of get. So in the interim, so that they're not feeling that sense of stress and kind of in that interim. Mark, you also talked about, Alana, I saw you come off mute, so I'm sure you're probably thinking the same thing I am. There needs to be a little bit of flexibility on the other side too, because what we can do is we can get you an assignment right away for our travel nurse recruiters. A lot of the facilities that we work with do have those auto offers that Mark was talking about that are really quick turnaround time. Alana, something else, and then we'll get back to the questions because there's a lot out there.
Yeah, I was just going to touch on what Jason said. It's amazing how AMN has so many different staffing solutions, and the recruiters really do all work together. Like, I'll just call up someone from Per Diem and be like, hey, I have a travel nurse, wants to take a month off, but wants to still make some money. What do you have? Here's their number. Give them a call. It is really such an easy transition when you're all within one agency and everybody works together to get you exactly what you need. So I just wanted to point that out.
Yeah, absolutely. And our clinicians are always top of mind, and we want to make sure that you feel like you're in a good spot. So thank you for calling that out, Alana. All right, let's see. We've got a question here. Is there CISTA staff available on the unit, i.e. an IV team, secretaries, CNAs, etc.? We do have some of those pieces, and I know, Jason, you have a couple of them in local. It's not where we see the biggest need. So the vast majority of what you hear us talking about are our RNs. I will say that there's a lot that we're trying to look at for how we can provide maybe some additional training and support to help our team members who are in those kinds of supportive staff specialties grow their career and become a nurse if that's something that they're really passionate about, or stepping someplace else. Jason, anything to add?
I think you covered it pretty well. Yeah.
Yeah, perfect. Good. I love it. I love when I can cover the topic. Let's see. What states have the most local assignments, Jason?
California for sure. That is our number one. New York State would be another. But we're seeing an increase in Florida, even Illinois. Really across the board, we do a lot of work in a lot of states. So I'd say West California, down south in Texas, Florida, New York would probably be the ones that come to mind.
Yes, but really everywhere.
Yeah, pretty much. Yeah.
Pretty much everywhere. All right, I'm going to give us a quick little break. Thank you for all the questions so far. Please keep them coming. I do have another giveaway, and I want to make sure that I get to it because this one's really fun. So giveaway number 2, our prizes are a $200 JanU Scrubs gift card and a Nurse Essentials package, which includes compression socks, a watch fob, a Brita water bottle, and a flashlight clip. So awesome package. All you have to do for it is take a screenshot. So you heard us talk about it a little bit earlier. Take a screenshot of a job in AMN Passport that you would like to take so you can kill 2 birds with 1 stone. Check out all the jobs that we have available. And also let us know where you want to go. And then just DM it to our Instagram handle, which is at AMN Nurse. So jump onto Passport, take a screenshot of a job that you really want to take, and DM it to us at AMN Nurse. We'll have 1 lucky winner of that amazing gift package, Nurse Essentials package, and scrubs, which I think you could probably use an extra pair of scrubs always, right, Mark?
Always. You never know what sort of grossness is going to get on your scrubs.
1 less that you need to wash in the rotation. All right. Karen, So maybe I have my idea of what AMN is. Is this a healthcare solution as an insurance, or is it a travel nurse company? I'm thinking my first take was wrong. I love this question. So Karen, we really brand ourselves as a total talent solutions company. So what we do primarily, AMN grew up first as a travel nursing company. So that is at the core of what we do. But we also support all kinds of different things. So you heard Mark talking about international, so bringing clinicians in from outside of the United States. Jason's talking about local or per diem, which is right in that area, or just that gig economy type thing where you can pick up a shift here and there. We also offer locums. We offer, throw them out there, guys. I mean, there's all kinds of stuff. We have translation services, which is really, really cool. We started to see a lot more with that, which is really awesome. Pretty much anything that you can think of that comes to staffing, but also helping our clients with their analytics and understanding their needs and how to appropriately staff, and just so many other things that we do. Mark, Jason, Alana, what else would you add?
We also do techs, scrub techs, surgical techs. I mean, dialysis techs.
Executive searches for health systems.
Executive searches. Yep. Mark, anything else?
On the international side, we're bringing in med techs on our end. We've had a physical therapist before, so pretty much anything and everything
Language
you can
services.
imagine. And healthcare, we've got it.
So that answers Karen's second question, which is you also place physical, occupational, and speech therapists. So yes, our allied division does that as well. And they're also on the AMN Passport app. So Karen, if that's one of your specialties, jump in there because you can be matched with a recruiter. What type of charting system is used? Will there be training? So the charting system is dependent on what the facility is using. Typically, there's an orientation and some element of training. Mark, you could probably speak to that a little bit more than I can.
Yeah, so when you get there and you're starting to work out your assignment, a lot of different learning opportunities. Once again, I think it goes back to voicing what you need. Where are you comfortable with? You'll also get, those pre-arrival education modules that you can do. You have full access to HealthStream as an AMN traveler, full catalog for earning your CE credits. If there's a particular skill you want to pick up while you're on assignment, maybe for going back to CVICU VADs and different devices that you may have, speak up, talk to your manager, say, hey, I really love it here. Would love to learn more on how I can help your team with additional training on this particular topic or this particular intervention. And then once again, relying on that clinical team that you have here, we can send all sorts of resources. I have a whole folder just of anything and everything to send over to our nurses as it comes up and what they need.
Yes, I love that, Mark. And so you heard it again loud and clear, but just communicate with us how you're feeling. We have a lot of resources that we can support you with, lots of things that will help you make sure that you feel confident on the unit as well. Such great comments in here. Just love the AMN support system. We absolutely do love our nurses, Caitlin, so thank you for saying that. Can you please update? So maybe Alana, this can come to you. And Jason, I don't know if it looks different for you as well, but update on EMSA for California. Can someone apply for a position without an active California license? Alana, do you want to start us?
Yes, absolutely. So where we're at right now is you needed to have applied for the PERM and TEP license before November 30th or on November 30th, 2022. If you didn't, then your assignment would need to end by February 28th of 2023.
Perfect. Thanks, Alana. So if you didn't apply for it, then you would just have to end your assignment by February 2023. So still got a little bit of time, but definitely make sure that you're applying for that California license. If California is someplace you want to go, just go ahead and start that application process. We can also help you with that. So again, reach out to your recruiter so that they can help you walk through that process. Jason, anything different for you on EMSA?
I don't.
All the same. And then in the meantime, right, Jason, while they're getting to California, if they don't want to take a travel assignment, they can also take a local assignment or something that is per diem close by. All right, Karen, we will definitely have someone connect with you after this event. So thank you for that. Let's see. Scrolling through here, great CNA. I've been working for 28, including 11 years of working with hospice. Thank you, Miss Bernice. Appreciate that. Is there any room? Download AMN Passport, get connected to a recruiter, and we can absolutely see where we can help you. But thank you for all that you do. We just so appreciate you. Michelle, Jason, you like this? Per diem nursing is so convenient. It is very flexible, so we're glad to hear that coming. Chrissy wants to know more about high nurse to patient ratios and what to expect. Mark, do you want to hit on this a little bit, and then we'll take it to our recruiters?
Yep. So definitely, probably as I alluded to a little bit earlier, a multitude of issues can come up or concerns. I probably should say while you're on your assignment, one of those definitely right now is higher ratios. They're far higher than what they used to be, 3-4 years ago. The key is, once again, knowing your chain of command. If you have a true safety concern on your unit, who are you escalating to? There is bound to be an online reporting system for escalating a concern, and that could include nursing ratios. Step one, though, have that conversation with your charge nurse. If you get there and you see your assignment is crazy, sit down with the charge nurse, say, hey, what's going on? This feels a little bit unsafe to me. And then that's where you follow those steps and chain of command. If you aren't getting the appropriate response or the response that you feel to be safe, you have those reporting systems built in within the hospital. It doesn't matter if you're a traveler or if you're a core staff member, fill out that reporting system, let them know you have a concern, follow up that report with an email to your manager, follow up that report with an email to your clinical manager here at AMN if you know who that is. If you don't, once again, Passport app to try to look them up, or reach out to your recruiter. Your recruiter will definitely get in touch with your clinical manager if they need you. And then on our international side, our clinician support specialists, they'll get in touch with them and send it over to us as well. But the biggest thing is following that chain of command. That's my biggest piece of advice, and open communication. Once again, escalating that concern. If it's really unsafe, truly unsafe, not getting that response that you need in real time, you keep going up. Once again, manager, house supervisor, if you're on the night shift, or whoever you need to reach out to.
Yeah, thanks for that, Mark. And we, I will say, we appreciate all of our clinicians who are out there who are every day putting patient safety at the top of their priority list and following that chain of command. What you're also hearing Mark say is that we can also help be your advocate and really help walk you through or understand where that ratio is or why it is the way that it is, or help you with that conversation as well. So hopefully that helps you a little bit as far as what to expect. Chrissy, we know that there's high demand for you. What you're also hearing loud and clear for us is there's a lot of need for all of you. And we want to make sure that we're putting you in that great environment and also helping to support you. Steve, and we're at 47 minutes, which is crazy to me. So I'm going to go through these questions. I may have missed this, but any thoughts on pay rates across the board for travel nurses in 23? Steady, lower, increase, or specialty dependent? So I'm going to turn it to my recruiters, but we know that pay is top of mind for all of you, as it would be for all of us. And we know that during COVID, there were those really high spikes and peaks. There was also a lot that came with that in working those 48, 60, 72 hours. So really, really long, very hard days that have contributed to that burnout that you're all feeling. We do anticipate that we're going to level back out. And then, as Alana was talking about a little, see spikes for certain specialties where the demand goes higher. So currently, unfortunately, with RSV, but as Mark was talking about, where we see spikes kind of normally with flu season or with baby season and having those maternal child health specialties increase. So anything, Alana or Jason, that you would add? And I'm going to try to get through the rest of the questions.
Yeah, you hit the nail on the head. I was going to say the same thing. I definitely think, since we're heading towards the end of a very devastating pandemic, everything's going to start stabilizing and steadying out. And you will see increases with those demanding specialties, like Saundra said, for RSV, baby season, flu season, stuff like that. You'll kind of see spikes here and there, but relatively, we're kind of seeing everything steady out within the market.
Yeah, and steady out. And I think I'll add, Steve, that stay higher than they were pre-pandemic. So that's what we're really seeing across the board, is that those rates will tend to level out, which should be a good feeling for all of us. But they're higher than what they were pre-pandemic. You know, we know all of the work that's going in the facilities. See that they know they need to attract those really great clinicians to come in and work for them, so that, as Mark said, they can keep you from traveling again and keep you as part of their core staff to really support the community and support the areas that they serve, right? Fred, let you know, Mark, great story. So thanks for sharing that. So cancellations may seem like, gosh, they're happening. And it is a scary part of travel nursing, but it has always been. It's just really about us knowing who you are and helping you find whatever that next step is. So it's a small piece. It can be a little scary, but let us help you through it. Sarah loves AMN having multiple staffing solutions. We do too. We love that we can share that with all of you. Is there anything in Georgia? So just quickly, Alana and Jason, give me a nod of the head. Jason,
yes, I mean, we staff nationwide. We staff nationwide, guys.
Yeah.
Get in with a recruiter. We'll find you somewhere.
We have a lot going on in Georgia. So we're seeing a big spike there. So Georgia is a place with where we need a lot of support. So come to Georgia.
I love it. Go to Georgia, Sarah. Jason's going to find you and reach out to help you get there. And Michelle, what a great gift package. I agree. And then Mantu Roy, travel states. I'm not sure what you're asking for specifically, but for travel, if you're asking what states do we have travel assignments in? Every single one. We can pretty much get you anywhere you want to be, depending on what it is that you're looking for, what you're interested in. Call your recruiter, get on that AMN Passport app. Let us know what it is that really interests you so that we can help you. If it's high pay and you're willing to go anywhere, then we'll get you there. If it really is, hopefully we're getting back to it, but really the experience for you, we want to know what that experience is and help you. I will make one little plug here. So we know that as you are traveling and getting back to this adventure piece, having those experiences is such a big part of being able to travel. Mark, I'm sure that you could tell us a long story about all of the different things that you and your wife saw while on your travel adventures and really checking off those bucket list items. So this is a big transition that we're making. We know you all love AMN branded gear. Obviously, we all do too. But we know that you're looking for that community, for an experience, for that memory that can really last a lifetime as you transition into your full-time job, whether that's full-time nursing or whether you're going to full-time travel nursing, or if you're going to become one of our clinical managers like Mark. We want you to have those experiences. So if you're a traveler with us now, you'll start to see some more on that. And you will see those experiences on our Passport app too. So if you've come to Southern California and you want to go surfing, we might be able to help you there. All right. So our last little giveaway here, we'll talk about, and then we are going to wrap it up because I know Rachel said, don't go over an hour. We tend to lose everyone. So I don't want to lose you. We have one last giveaway. So we have an Apple Watch Series 7 and a Keurig. So Apple Watch Series 7 and a Keurig, which is pretty awesome. All you have to do is just follow at AMN Nurse. So follow us on Instagram and comment #GypsyNurseLive on our recent picture. And you'll be entered to win this really cool prize package of an Apple Watch Series 7 and a Keurig. And I'm pretty sure you can take both of those with you, whether you're on a local assignment or you're traveling. And a Keurig, right, Mark, is probably a nice thing to have.
Definitely a must.
Day shift or night, you gotta have that coffee. All right, well, I know that we are at the end of our time, but I just wanted to end the same way that we started, just in gratitude to all of you for joining us, for having such great questions and such great dialogue with us. Hopefully you learned something. Hopefully you're excited about what 2023 has to offer. We know we're excited to go through it with all of you. And as we just wrap up with December, which again is crazy that bigger holidays are happening, and in a couple of weeks it's going to be the new year. But just thank you to all of you. We hope that you get to enjoy some time off with your friends and family, and really get to celebrate in the warmth of the holiday. But if you are not and you're traveling, or you're working on those days, we just appreciate you so much for being there for our family members, for our friends. You can ask pretty much any person at AMN if they feel what it is that we do. And I think we feel it every day. We've had family members that have been taken care of in hospitals by you, our travel nurses. I know that when I gave birth to my first child, one of my postpartum nurses was a travel nurse. So just being able to see that come full circle is really powerful. And we're just so appreciative for you, for being there, for spending the time with us, with our families, with our friends, and just being that person. So thank you again. We appreciate you. Thank you, Rachel. I know you're going to pop back up, for bringing us back on.
Of course.
And we love spending time with you guys.
Definitely. Thank you so much. And you can always go over an hour. I know everyone else loves you too. And you guys had a ton of great questions. If anybody else has any questions, follow them on Instagram so you can get in that giveaway, and then also, DM them and ask them questions too. So I know they'll be happy to answer that. And don't forget to register on thegypsynurse.com to win your $500, or for a chance to win $500 this Friday. So thank you again so much. Well said what you said there at the end about the nurses. You guys are all near and dear to all of our hearts. But thank you, everybody, and have a great week.